Hello, my name is Patrick Brown, Mayor of Brampton, and I'm joined today by Dr. Lawrence Lowe, our Peel Medical Officer of Health, and Paul Morrison, our Commissioner of Legislative Services and the head of our bylaw department, to share our weekly COVID-19 update. And thank you for tuning in today. To begin this morning's update, I want to bring awareness to the fact that tomorrow is Bell's Let's Talk Day, and I know this has been a really challenging year, and not just the health pandemic or the economic tidal wave, but there's been real challenges when it comes to mental health, and I want to thank Bell for having this conversation, and it's great that the City of Brampton can be supportive and part of it. I'd like to remind everyone that there are a variety of services available for residents during this difficult year, and if you want to have someone to talk to, you want to reach out for non-emergency services, I encourage everyone to call 211. This is a free and confidential service that connects individuals and families to a complete range of non-emergency services like health and mental health supports, financial assistance, senior support, and many other services. By taking part in the ongoing conversation on the actions we can take, we can help enable better mental health for our families, friends, and colleagues. And so remember, that is only a call away. I also want to share an update that the Backyard Garden program we've officially announced will be back again this spring. Now last year, understanding there was a stay-at-home order, we launched our first ever Backyard Garden program. It was the brainchild of Councillor Doug Willans, and I was blown away. 10,000 residents wanting to participate, build backyard gardens. It's great for the environment, it's great for food security, and because it's so popular, we're bringing the program back this spring, and you can sign up now at brampton.ca/backyard garden, and hopefully it'll be even bigger than last year, and a great example of how Brampton is the flower city, how Brampton is a green city. I also wanted to touch upon sick days. This week marks the first anniversary of the first identified COVID-19 case in Canada, and I think there's been an ongoing effort by governments to adapt and to make sure we have the tools to respond to this crisis, and I think the response has evolved. One area that I feel strongly we haven't seen an adequate evolution of the tools we're using is when it comes to paid sick days, and the GTHA mayors have been outspoken on this as our number one ask, that we need to make sure we have tools for our frontline essential workers that continue to go into work day in and day out, and too often they're going in with symptoms. Just this week, Peel Public Health shared with the mayors in Peel Region the data, and the data, it speaks strongly of why this is so key. 25% of the cases that we've identified through contact tracing were of individuals who had gone into work with symptoms. And this could have avoided outbreaks. This could have avoided community spread, and I'm sure Dr. Lowe can speak about this in greater detail. But it is a real problem that we don't have paid sick days. There are people going to work when they shouldn't because they can't afford to miss a paycheck. For many, it's a choice of putting food on the table or paying their rent check. And no matter what I hear from Ottawa and Queen's Park, the existing programs are not adequate. The Canadian Recovery Sickness Benefit takes months to receive, and it's below minimum wage. And if you're living paycheck to paycheck, you can't wait 3 months. This needs to change, and I can tell you mayors across the GTA and across Canada are going to continue to champion this as an important tool, because paid sick days save lives. I also want to thank today Deputy Prime Minister Chrystia Freeland for recognizing the need for tougher travel measures for air travelers returning from non-essential trips abroad. I think this was long overdue, and if you look at the countries that have had effective COVID responses, this has been one of the tools they've used. And thank you to Premier Doug Ford, who has been championing this as well. If you look at some of the tragedies that we've had around the province and some of the outbreaks, they've been related to travel, and you can't ignore that fact, and we need to have greater protections for our country. And I should also recognize that Councillor Michael Peleschi in Brampton put forward this motion in April, and so we've had some great minds in Brampton who've been suggesting this since the beginning of the pandemic, and it's great to see that the federal government is responding and taking these necessary steps. I also wanted to share an Osler update today. Dr. Naveed Mohammed and his team continue to take on a heavy workload. As the number of COVID-19 patients in hospitals remains high, Osler is introducing new hours for its COVID-19 cold and flu clinic and the Brampton COVID-19 testing center, both located at Peel Memorial Center for Integrated Health and Wellness. Effective February 1st, the COVID-19 cold and flu clinic will open at 2 p.m. and stay open to 8:30 p.m. At the Brampton COVID-19 testing center, it will open at 2 p.m. and stay open till 9 p.m. daily. These changes align with the hours of peak demand of when people are coming in. This past week, we saw more options for COVID-19 testing come to our community. As you know, we now have testing at Embassy Grand, the COVID-19 testing site at 8800 Gore Road at Queen. Osler continues to be a leader in administering tests, having performed 347,015 tests across its sites in Brampton and Etobicoke. In terms of Osler's current capacity, currently there are 48 patients at Brampton Civic Hospital, and 11 of those patients are receiving care in the ICU. And lastly, for a bylaw update, between January 18th and January 24th, there was 5 charges under our mandatory face covering bylaw, 14 charges under the Reopening of Ontario Act, and 7 charges under the Emergency Management and Civil Protection Act. So we are seeing a high level of compliance, and I want to thank the residents for listening to the advice of public health. On that note, I'm going to ask Dr. Lowe to share his update, but in advance, I just want to let those who have tuned in, we're only going to have time for a few questions today because our council meeting does start at 10 o'clock. Dr. Lowe.
Good morning. Thank you, Mayor Brown, and good morning, everyone. Brampton's test positivity this week sits at 11.7%, down from 15.2% last week, with a weekly incidence of 245.1 cases per 100,000, which is down from 343.9 per 100,000 last week. On January 23, 2020, Peel Public Health entered emergency operations in response to reports of a novel pneumonia outbreak first detected in Wuhan, China. On January 25, 2020, our colleagues at Toronto Public Health reported the first detected case of COVID-19 in Canada. A year later, we remain engaged in the longest emergency response Peel Public Health has undertaken since the founding of the region of Peel in 1974. Together with all of you in the community, we have made great strides in controlling and interrupting transmission of this disease. By staying home and limiting our interactions beyond our household, we together have saved lives, protected the healthcare system, and minimized the impacts of the pandemic in our wider community. The worst case scenarios that have been seen elsewhere have thankfully not come to pass. But make no mistake, our situation does remain tenuous. 1 year later, we are at a critical turning point in our efforts. What we do now together will define our future. The arrival of COVID-19 variants in Ontario, with some identified cases in our community, threatens the progress that we have made. At the same time, supply of vaccine remains critically limited, which means our next steps are difficult, even if they are simple to understand. We must stay fixed on this goal. We cannot get distracted or complacent. And our goal is simple: avoid getting COVID until you get the vaccine. We must stay focused on doing so that we can keep transmission down to keep the variants from spreading, holding on until more vaccine supplies arrive that we can put into arms. We have a vaccine that is safe and effective, and once the supply issues are resolved, Peel Public Health and partners are ready to make it easily and widely accessible. I absolutely will take the vaccine when my turn comes, but I remain patient in waiting for that day. And I ask for you, too, to also give us your patience. At this time, we only have enough vaccine to vaccinate our most vulnerable in accordance with provincially directed priority groups. But in the meantime, we need to avoid getting COVID by sticking to the precautions. So please, limit your contacts and stay home. There's an end in sight, and it's just months away. Importantly, for our essential workers, we really need those supports that we continue to advocate for. An analysis that Peel Public Health recently undertook found that 25% of our cases since August worked at least one day while symptomatic. That means 1 in 4 Peel residents who later tested positive for COVID went to work sick. And that shows the impossible choice that many of our essential workers face: self-isolate and give up their pay, or worse, lose their job, or head into work and risk spread. More must be done. Inspections, investigations, and protections. Rapid tests, paid sick days, blitzes, and support for our temporary and contract workers. All of this is needed for all of us to come together to stay the course and support our frontliners. Thank you very much, and I'll pass it back to Mayor Brown.
Thank you, Dr. Lowe, and we'll try to get a few questions in today. First question is Courtney Hills from CP24.
Good morning. This question is for Dr. Lowe. It's regarding the COVID-19 outbreak at the Canada Post facility, the Gateway plant. Dr. Lowe, we're hearing reports of an employee who worked there who recently tested positive for the virus and passed away. Are you able to confirm a fatality connected to the facility?
Thanks, Courtney. As there is an active investigation that's occurring at the Canada Post Gateway, I'm unable to confirm details of that nature. Certainly I'll review with our team, and as more details are able to be confirmed, we will release what we can. At this time, we do know that a number of shifts have been sent home, and also that rapid testing continues. Thanks very much for the question.
Okay,
All right, and Dr. Lowe, my next question also for you, sir. It has to do with the UK variant, the fact that we're seeing this variant spread quickly in the Barrie area. I understand Peel Region confirming 2 cases so far. So can you give us a better sense of how the variant might be spreading in Peel Region, if at all?
So at this time, we have a number of cases. I believe 2 is the one that Public Health Ontario have, but I think for us at Peel Public Health, in the midst of entering data, we actually have 3. And all of the cases have an association with travel and or close contact to travel. That said, I should emphasize, by virtue of the variants being in our community and possibly circulating, we need to make sure we're sticking to the precautions as much as possible. Thanks very much for the question.
Shauna Hunt from City News. Shauna?
Oh, hi there. This question is also for Dr. Lowe, and it's also about the UK variant. Just knowing, obviously, it's spreading in Barrie. We're hearing more and more cases. You just announced 3 cases in Peel. Of course, travel-related. I just want to know how worried you are about this variant spreading and becoming the dominant strain. I know that right now case counts are coming down, and I think many of us are starting to feel pretty good about that. Could that all change with this variant?
Absolutely, Shauna, you've said it. I think that's what I was referring to in my remarks. I think at this point in time, if we start to let down our guard and increase our contact interactions, then we will potentially see more spread of this variant. I think the outbreak that we saw with our colleagues in Simcoe reflect the fact that there is community transmission occurring in some parts of Ontario, and knowing that there is still interconnections across the Greater Toronto Area, certainly a cause for concern. Thank you very much for the question.
And just quick follow-up, how likely is it that the stay-at-home order will be lifted, on February 9th as planned?
Thanks very much, Shauna. That's a point of active discussion with our provincial counterparts and with health units across this province at this time. I think we need to continue following the trends before we make any decisions around if it continues, or at least rather if the province makes any decisions around if it continues or what aspects may be considered for modification. Thanks very much for the question.
Okay, Irene from 680 News.
My question is also about the variant. I'm wondering, we've seen what happened in Barrie. Are there any extra precautions being taken at local long-term care homes so we don't see what happened in Barrie happen in Brampton or Peel Region?
I'll have Dr. Lowe speak to that as well.
Yeah, thanks very much for the question, Irene. Certainly Peel Public Health, since the course of the first wave, has had an integrated response table that oversees everything from staffing to infection prevention and control to outbreak response. It basically is ourselves with our hospital partners, Ontario Health, etc. They've done paramedics, etc. They've done a tremendous job and actually forestalled the introduction of COVID-19 into our long-term care homes, even in the earlier parts of the second wave, and so I think they've continued to do a tremendous job. They're continuing to monitor the outbreaks with concerns. Obviously, we are seeing certain outbreaks because it does reflect the high levels of community transmission that we have. But really, at this point in time, our integrated response team is in place. They continue to monitor things. This was the same team that actually managed to do swabbing of every single long-term care resident, in the region of Peel, 28 out of 28 long-term care homes before the provincial deadline during the first wave. Thanks for the question.
My follow-up is also for Dr. Lowe. We've seen the numbers in Peel go down. Is there any worry that people see the numbers on a downward trend and letting their guard down? How big of a concern is that?
Absolutely, Irene. That's why in my remarks I said our goal at this point in time, everyone's goal at this point in time, should be to stick to the precautions as much as possible so that you don't get COVID, you get a shot instead. So the goal is to make sure that you get to the vaccine because ultimately, certainly the vaccine and the cost benefit in terms of its safety and effectiveness certainly outweighs the uncertainty and roulette that you'll be playing with in the event that you do get COVID. Thanks for the question.
Okay, Graham Frist from the Brampton Guardian, and this will be our last question today just because we have our council meeting. I know we have a number of other people on the list, but it's a council day in the city of Brampton. Graham.
Morning, guys. First question for Dr. Lowe. Now's the first round. I guess it's been a week now since the first round of vaccines has been administered in long-term care homes across Peel. Are we seeing any effects? Are the numbers improving in long-term care homes, and is the vaccine appearing to be effective?
It's a great question, Graham. I'll probably have a better answer for you next week. Certainly just we want to give those 2-week pieces out there, and also when we're starting our second dose with the Moderna that we're anticipated to receive. Thanks for the question.
Okay, follow-up would be for Dr. Lowe as well. Okay. Just going back to the variants, have any of the South African or Brazilian strains been identified in Peel yet, and what do we know about them?
So no, neither of those have been identified in Peel just yet, but again, there is evidence to suggest that they may be more transmissible, and there's also some question around whether some of them may confer a partial or mild resistance to the vaccines that are in place. Certainly all that information is continuing to be reviewed and studied at this point in time. Thanks very much for the question.
Okay, since that was quick, we'll get one more in. Sumit Dami from Omni News.
Hi there. My question is for Dr. Lowe as well. Regarding workplace outbreaks, I know all the calls that are being made for paid sick days. As of yesterday in the Canada Post facility, there have now been 224 positive cases. And you've mentioned that a lot of them are hard to quantify because a lot of people can't really go and get tested because of work. So while the calls continue provincially, what kind of things are being done locally or can be done by Peel Public Health to look out for these workers who predominantly are from minority groups?
Thanks, Sumit, for the question. I'm still very proud that Peel Public Health was the first health unit in the province to issue a Section 22 requiring employers to comply with outbreak investigations and the directions and precautions that need to be put in place. And of course, we continue to work with the Ministry of Labour, with the Ministry of Health to deploy some of those measures. The province has given us rapid tests that we've deployed in settings such as the Canada Post outbreak, as well as certainly the ongoing workplace inspection blitz together with the Ministry of Labour to protect occupational health and safety. So we're firing all cylinders. Thanks, Sumit.
Thank you so much. I appreciate that.
Okay, well that will complete today's public health update, our COVID update from the city of Brampton. And as always, stay safe, stay healthy, and there is light at the end of the tunnel. We're going to get through this. Thank you so much.